So, welcome. And firstly, I would like to say a big congrats on making it this far in your course. And welcome to this presentation about the Oriel exam. I am not a teacher. I am currently in my pre-reg year, and this is all my opinions and not any official advice. This is just the mindset that I was in to be able to score in the top 5% of the students in the Oriel exam, and I got ended up getting my second choice. And hopefully, this presentation will be able to give you more um, tips and some more advice on how to rank high in the Oriel exam. So the content of this presentation, I'm gonna give you a brief introduction on the scoring system. So this might change. This was true for the year 2024, um, and and then I will give you key tips that ranked my SJT in the top 5%, and then I will also speak about the math a little bit because it's also part of the exam, and at the end I'll end it with some bonus tips on preferencing. So how is the exam scored? The situational judgment test. It's gonna have two sections, section A and section B. Section A, you'll be given a scenario and five options, and you will have to rank these five options from most appropriate to least appropriate. If you rank one of the options in the right place, that will score you 5 marks. If you rank it one place off the correct option, then that will give you 4 marks. And if you rank it 2 places off, that will give you 3 marks, and so on and so forth. In section B, you are given a scenario with 8 options, and you need to choose the 3 most appropriate options out of the 8. Each option that you identify correctly will give you 5 marks. If you don't choose the right option, you will get 0 marks for that option. So this is slightly different from section A. And you will have about 2 minutes per question. Hopefully that makes sense, and let's jump straight into what you came here for. The first tip is being familiar with what your limits are and what your colleagues are able to do. So you are going to be doing the exam as a pre-reg pharmacy student. So your mindset should be that you are a pre-reg pharmacy student. This means you cannot prescribe or recommend a medicine for a doctor to prescribe. However, that does not mean you cannot intervene if you think that there is an interaction or a potential harm to a patient. This will be obvious in the exam. So for example, the question might say, you notice on the drug chart that drug X interacts with drug B, as you remember from your lectures at university, and the nurse is going to administer these medicines. In this situation, you need to intervene and ask the nurse not to administer the drugs, and then you need to raise this interaction with the prescriber or the supervising pharmacist for confirmation in the order of priority. And another important point is knowing your colleagues' responsibilities and limits. So in the exam, you will see professionals such as pharmacists, junior doctors, nurses, consultants, pharmacy technician, and pharmacy dispensers. You might see more, but these are the ones that I've seen. It's helpful to know their roles, as sometimes you get a scenario and you need to recognize your limits and what is the most appropriate referral. And when you refer an issue, consider if the person you are referring the issue to will be able to solve the problem, or will the person you're referring to end up referring it to someone else, and then that's not very efficient and prolongs the issue. The next tip, you need to put your patients first, and then your colleagues second, and yourself as last. So in order to do well in the exam, you need, as I said, to put your patient first in every decision that you make, especially when it comes to patient safety. Don't do anything that compromises patient safety. For example, don't rank an action that is outside of your competency as high. Remember, you are solving the exam as if you are a pre-reg pharmacist. Your colleagues are also very important. You must support them if they ask, but you need to balance that with your own responsibilities as well. So the scenarios that you get given might sometimes tell you that you have a deadline or tasks to complete. These should not be regarded as less important than supporting your colleagues if they need your help. But you should balance between both your colleagues and your responsibilities and not disregard either one. So rank high the options that take into account both your responsibilities and colleagues' needs. And what I mean by put yourself last, it means your convenience. So you need to rank options that prioritize your convenience as low. So your convenience is different from your responsibilities. For example, if a patient comes in during closing time to the pharmacy and says they have run out of their medications and need a supply, it's convenient for you to tell them that you are closed and then send them somewhere else, but that's not appropriate and that should be ranked as low. However, your responsibility should be something like a deadline, which you need to take very seriously and balance it between other issues in the question and not completely discard them. The next tip is be proactive. So always consider the option of doing something before referring a query or a patient to someone else. So for example, if a patient asks you if they could take their medicines with food, but you don't know the answer, you need to try and find it out first, because you're expected to know this as a pre-reg pharmacist. You can just look at the patient information leaflet. Don't immediately refer to someone else. If you have to refer a query, try to refer it to the original source. So for example, if your colleague asked you about something that is outside of your competency, but you don't know the answer, but you know where to get the answer from, try directing them to the original source rather than directing them to your, let's say, your supervisor, and then your supervisor will have to direct them somewhere else, and then it prolongs the problem. So you need to be efficient and try to refer them to the original source. The next tip is to not let anyone rush information out of you. So always rank the options that are a guess as low, because they put patient safety at risk. If a patient or health professional asks you a question and they are in a hurry, don't guess or do things that prolongs their wait. You need to be honest and you are not sure, and either tell them that you need to look up the information given, as long as it's within your competency, or refer them to the appropriate source. Whichever one will get the query answer the quickest should be ranked as higher. The next tip I would say is don't escalate situations. So your priority should be to resolve matters. So for example, if a patient comes in angry, then your order of priority should be apologize, resolve the issue, and then investigate. Never play the blame game, especially not in front of patients. So the blaming others should be ranked as very low, especially in a way that undermines them. The next important tip is fairly important as well. It's speaking up. So if there is something wrong that you need to challenge it. It doesn't matter what the authority of the person doing the wrong is. you should always bring it up. Whether it's a nurse or a consultant, you should always bring it up and speak up about it if you think there is something wrong. I know it can sound intimidating, especially in real life, to challenge a person who has more experience and authority than you, but at the end of the day, you have to think that patients are above everyone else, and you should work and act in their best interest and challenge those who don't, whichever authority they are from or have. There are levels to escalation depending on the situation. You should try to gather as much information as possible before making a decision. So always rank options that are you being inquisitive as high. So options that say that hint at you investigating, those should be ranked high. And then when you decide to speak up, make sure you are making a report to the right person proportional to the situation. So for example, if your colleague is not doing what they are supposed to do, you should try speaking with them rather than reporting them to their manager. And obviously, when you're talking to them, you need to speak to them in a professional, respectful manner. If one of the options says, oh, shout at them or, undermine them, that should be ranked as low. Also, if a colleague has made a mistake, make sure you inform them about it so that they can learn from it. But again, you need to do it in a considerate way and not undermining them. Pardon me. And finally, you should also speak up for yourself and to not just endure things. For example, if you are finding things too much, you should try and speak up with your supervisor about it or someone you trust, rather than powering through it for a few more weeks until you are done with your pre-reg. So again, always be proactive. The next tip is don't put yourself or others in danger. This might be common sense, but it can be missed sometimes. So always prioritize safety over matter, whether it's your safety or the patient's safety or your colleague's safety. So for example, if there's a dangerous situation, say physically aggressive patient or shoplifting, don't try to confront the aggressor. Either call for help or distract the aggressor. But if the patient who is being aggressive is not physically aggressive, then you can directly intervene and speak to the patient. But if there is a physical threat, then you should always either call for help from someone who is qualified to deal with physical confrontations, or distract until help arrives. The next tip is translation questions. So I got one of those in the exam, I think, if I remember correctly, and it's also a common question. So always use an official medical translator, as they are most qualified to give advice. So options that say use an official medical translator, these options should be ranked as high. And you should never attempt to translate things yourself using the internet or your limited knowledge in other language. Let's say if you learned from Duolingo or something. That option should be ranked as low. And in the middle, you might rank using the patient's friend or daughter or son. But using medical translator should always be ranked as high. And translating things yourself using the internet, like Google Translate, that should be ranked as low. Another common question is the confidentiality question. So if a patient wants to find out information about other patients, then you should never give this information out, except in very exceptional circumstances. So always maintain confidentiality and explain to patients why you cannot give out this information. This should be your highest or very high in your priority list. And then you will consider referral options. And then the last things that you would rank is options that are giving out confidential information. The next step I will say is don't tunnel vision points and balance between different points. So usually there are two things going on in the scenario, and you need to balance between them out to resolve the issue. For example, you are doing something urgent, but a patient approaches you for help. You need to balance between the urgency and your duty to help. So you want to try and help, but you also want to consider if helping the patient will take a lot of your time and might undermine the urgent task that you have. And finally, the math section of the exam. I would say it's nothing that I haven't done already, and it will consist of 10 questions. And I would recommend doing the official mock exam. And if you get more than 3 questions wrong under timed conditions, then I'll say go back and revise your math notes. Aim to complete the questions in under 20 minutes, and that's the official link for the mock exam. But it's a fairly straightforward calculations. Finally, some bonus tips on preferencing. So you want to approach this process as if you are getting your first choice and the last choice that you rank. So this is a very important stage of the Oriel process, and it's going to be very time consuming, but it's extremely worth all the effort. Because you will never know which rank you will get, so make sure you are happy with whichever placement you are putting in your preferred section. So don't be the person who only puts few places and then gets something outside of their preferred window, or someone who puts a lot of different things in their preferred section but without properly going through all of them and making sure they are happy with all those places. To help you choose, think about 2 to 3 priorities. So for example, I really cared about location and having my placement containing different sectors to maximize my experience. So I ranked all the options based on these 2 criteria, and I ended up having about 300 options, but I ended up getting my second choice. And thank you very much. My last words will be confident and don't overthink it, and best of luck to you. If you have any questions, please feel free to reach out to me through the email below. Thank you very much.